4:17 a.m. Memorial Hospital, intensive care unit. The night shift is winding down, but one man's work is just beginning. In 6 hours, this hallway will be flooded with doctors, nurses, and families fighting for lives. But right now, it belongs to Marcus Williams, 62 years old, environmental services technician. To most people, he's invisible. Just the janitor who empties trash cans and mops floors. Someone who works around the important people doing the important work. But in March 2020, when a virus brought the world to its knees, Marcus Williams became something no one expected. He became the thin line between life and death, between safety and catastrophe, between a hospital that could save lives and one that could spread death. This is the story of how a custodian making $16.50 an hour became one of the most critical healthcare workers in America, and why his mop and disinfectant were as important as any ventilator. Meet Marcus Williams, 62 years old, married to Rosa for 38 years, father of 3, grandfather of 7. For 22 years, he's worked environmental services at City Memorial Hospital. His shift starts at 6 a.m. and ends at 2:30 p.m. His responsibilities seem straightforward: clean patient rooms, sanitize surfaces, empty medical waste, mop hallways, stock supply closets. Marcus makes $16.50 an hour to maintain a 400-bed hospital. He's responsible for 180 patient rooms, 12 operating suites for emergency bays, and 3 intensive care units. But Marcus has never seen himself as just anything. He's always understood something that others missed. In a hospital, everything matters. Before the pandemic, Marcus was part of the invisible workforce that keeps hospitals running. He'd arrive before dawn, work through his checklist, and leave as the afternoon shift took over. Patients rarely noticed him, except to say thank you when he emptied their trash or cleaned their bathroom. Doctors and nurses acknowledged him with nods and brief hellos as they rushed between emergencies. But Marcus noticed everything. He knew which patients were scared and alone. He knew which families had been camping in waiting rooms for days. He knew which nurses were overwhelmed and which doctors skipped lunch 3 days running. Room 314, Mrs. Patterson, hip replacement, worried about her cats at home. Marcus always asked about them and brought her pictures of his own rescue cats. Room 318, Mr. Rodriguez, diabetic complications. Family drove up from Mexico. Marcus, who spoke fluent Spanish, would translate when interpreters weren't available. Room 322, 7-year-old Emma, leukemia treatment, missed school and friends. Marcus saved interesting magazines and comic books he found for her. Marcus understood that healing happens in clean, comfortable, dignified environments. His work wasn't separate from patient care. It was foundational to it. February 2020. Reports of a new coronavirus were growing more serious. Healthcare workers were starting to worry, but most Americans felt distant from the threat. Marcus had lived through SARS concerns, H1N1 outbreaks, and seasonal flu surges. He knew how quickly infectious diseases could spread through hospitals. While others debated whether this virus would really affect them, Marcus was already thinking about disinfection protocols, isolation procedures, and how to protect the most vulnerable patients in his care. He had no idea that everything he knew about his job was about to change forever. March 15th, 2020. Everything changed overnight. COVID-19 was spreading rapidly. Hospitals were implementing emergency protocols. Elective surgeries were canceled. Visitor restrictions were put in place. And environmental services staff were given new responsibilities that would make them frontline healthcare workers. Marcus attended a mandatory training session that lasted 4 hours. New disinfectants, new protocols, new protective equipment, new understanding of how a virus could live on surfaces for days. His job wasn't just about cleanliness anymore. It was about survival. The new protocols were overwhelming. Every surface in COVID patient rooms had to be disinfected with hospital-grade chemicals. Environmental services, staff had to wear full PPE, N95 masks, face shields, gowns, double gloves. Rooms that used to take Marcus 20 minutes to clean now took over an hour. The physical demands increased exponentially. The mental pressure was crushing. One mistake, one missed surface, one contaminated glove, one improperly removed mask could spread the virus to vulnerable patients, overworked staff, or Marcus's own family. Marcus was no longer invisible. He was essential. By April 2020, City Memorial was treating 180 COVID patients. The ICU was at capacity. Emergency rooms were overwhelmed. And Marcus was working 12-hour shifts, 6 days a week. He was cleaning isolation rooms, where patients were fighting for their lives. He was decontaminating equipment that could mean the difference between recovery and death. He was sanitizing spaces where families said their final goodbyes over video calls. The virus could live on stainless steel for up to 72 hours, on plastic for up to 3 days, on cardboard for 24 hours. Marcus's mop and disinfectant were literally wiping away death. The ICU during peak COVID was unlike anything Marcus had experienced in 22 years. Patients on ventilators filled every bed. The sound of alarms was constant. Families couldn't visit. Marcus found himself cleaning around equipment that was keeping people alive. One wrong move, one disconnected line, one contaminated surface could be catastrophic. He developed new techniques for cleaning ventilators without disrupting settings. He learned to work around dialysis machines and ECMO devices. He mastered the art of thorough disinfection while moving with extreme precision. Every surface Marcus cleaned could be harboring thousands of viral particles. Every room he entered put him at risk of infection. Every shift meant potential exposure to take home to Rosa, to his children, to his grandchildren. But Marcus never considered not showing up. Someone has to do this work, he told me. These patients can't get better in dirty rooms. These doctors and nurses can't stay safe if someone doesn't clean properly. If I don't do it right, people die. I'm not saving lives with medicine. I'm saving lives with bleach. By May 2020, supply shortages were critical. The hospital was rationing N95 masks, disinfectant, and protective gowns. Marcus was making single-use supplies last entire shifts. He learned to maximize the effectiveness of limited disinfectant by adjusting contact times and application methods. He developed systems for safely reusing PP when necessary. He trained newer staff on conservation techniques that didn't compromise safety. Marcus wasn't just a custodian anymore. He was an infection control specialist, a resource manager, a trainer, and a guardian of patient safety, all while making $16.50 an hour. The emotional toll was as challenging as the physical demands. Marcus spent months terrified of bringing the virus home to Rosa, who had diabetes, or to his elderly mother-in-law who lived with them. He developed elaborate decontamination routines. Clothes went straight to the washing machine. Shoes stayed in the garage. He showered before touching anything in the house. For 6 months, Marcus barely hugged his wife. He stayed away from family gatherings. He missed his granddaughter's birthday party because he couldn't risk exposing the children. The man who had always been the heart of his family became their protector by staying distant. By late 2021, vaccination rates were climbing and COVID numbers were finally dropping. The crisis phase was ending, but Marcus's understanding of his work had changed forever. He had seen how quickly a hospital could become overwhelmed. He had experienced being truly essential to patient survival. He had learned that there is no such thing as just a support role in healthcare. Marcus had helped Memorial Hospital avoid any major hospital-acquired COVID outbreaks. His meticulous cleaning protocols had protected thousands of patients, staff members, and their families. Today, Marcus still starts his shift at 6 a.m. He still cleans 180 patient rooms and 12 operating suites. He still makes $16.50 an hour. But now everyone knows what Marcus always understood. Environmental services isn't separate from healthcare. It's the foundation that makes everything else possible. Doctors can't perform surgery in contaminated operating rooms. Nurses can't provide safe care in infected environments. Patients can't heal in spaces that harbor dangerous pathogens. Marcus doesn't just clean hospitals. He makes healing possible. During the pandemic, America discovered that hospitals employ nearly 700,000 environmental services workers. People like Marcus who work behind the scenes to maintain the clean, safe environments that modern medicine requires. They worked through the most dangerous public health crisis in a century. They adapted to new protocols while dealing with supply shortages and staffing challenges. They put their own health at risk to protect patients and healthcare workers. Many contracted COVID themselves. Some died. All of them showed up when showing up meant risking everything. And most of them never got the recognition they deserved. These hands have cleaned over 180,000 patient rooms in 22 years. They've emptied countless trash cans, mopped endless hallways, and sanitized millions of surfaces. During the pandemic, these hands became instruments of infection control. They wielded disinfectant like weapons against an invisible enemy. They created safe spaces in a dangerous world. Marcus estimates he personally disinfected over 3,000 COVID patient rooms during the height of the pandemic. Each one a potential life saved through meticulous cleaning. These weren't just the hands of a janitor. These were the hands of a lifesaver. A modern hospital is a complex ecosystem. Operating rooms that must be sterile. ICUs that house the most vulnerable patients. Emergency departments that see everything from minor cuts to major trauma. None of it works without environmental services. None of it is safe without proper cleaning and disinfection. None of it functions without people like Marcus who understand that details matter when lives are at stake. During the pandemic, environmental services workers became the unsung heroes of infection control. They were the guardians of hospital safety. They were the protectors of patient health. And they did it all while being paid as if their work didn't matter. When I asked Marcus what he wants people to understand about environmental services work, his answer was both humble and profound. "We're not just cleaning up messes," he said. "We're preventing infections. We're protecting vulnerable people. We're making sure that when someone comes to the hospital sick, they don't leave sicker because of something we missed." During COVID, people finally saw that custodial work is healthcare work. That environmental services is patient care. That what we do every day saves lives, even when nobody notices. I've never been just a janitor. I've always been part of the team that heals people. Right now, environmental services workers are cleaning hospitals across America. They're disinfecting operating rooms where surgeries will save lives tomorrow. They're sanitizing ICU rooms where families will reunite with recovered loved ones. They make an average of $16 to $18 per hour to do work that directly impacts patient safety and healthcare outcomes. They work nights, weekends, and holidays to maintain the clean environments that modern medicine requires. During the pandemic, they proved they're not support staff. They're essential healthcare workers. They're not background employees. They're frontline heroes. And they deserve our recognition, our respect, and our gratitude. These aren't just people who clean up after others. They're infection control specialists who prevent healthcare-associated infections. They're safety experts who maintain sterile environments. They're patient advocates who ensure dignity and comfort through cleanliness. They're the reason your surgery is performed in a sterile operating room. They're the reason your hospital room is safe and sanitary. They're the reason healthcare facilities can function without spreading disease. They're heroes with mops instead of stethoscopes. Heroes with disinfectants instead of medications. Heroes whose uniforms might say environmental services, but whose work says Lifesaver. And most of them have never been thanked for the lives they save every single day. When the next pandemic comes, and experts agree there will be a next time, we'll need people like Marcus Williams. People who understand that cleaning isn't just about appearance, it's about survival. People who know that environmental services isn't just a job, It's a calling to protect the most vulnerable members of our society. People who show up every day to do work that others take for granted. But that makes the difference between a hospital that heals and one that harms. Marcus Williams was never just the janitor. He was always a healthcare hero. It just took a pandemic for the rest of us to see it. If Marcus's story opened your eyes to the critical importance of environmental services in healthcare, share it with someone who needs to understand that hospital custodians are healthcare heroes who save lives with every surface they clean. If you know an environmental services worker in a hospital, nursing home, or clinic, take a moment to thank them for the invisible work that makes healing possible. Tell them their attention to detail protects lives. Tell them they matter. And if you are an environmental services worker watching this after a long shift, remember Marcus's words. You're not just cleaning. You're preventing infections. You're protecting vulnerable people. You're making healing possible for every patient who walks through those doors. You're not just anything. You're absolutely essential. Subscribe to The Quiet Brave for more stories about the people who keep our world running safely. Hit the notification bell so you never miss a story that might change how you see the heroes working around you every day.